Assalamu alaikum. We will continue our session with the physiology of breathing. So we come to, in this video, to the respiratory volume and to the lung capacity or the respiratory capacity. In the normal breathing, mostly about 500 ml of air are moving in and out in the lung with each breathing. So with each breathing, around 500 ml of air are going in when we are exhaling air, or case in inhalation, and it will go out in the exhalation or expiration. So in inspiration and expiration, around 500 ml of air will go in and out, which is called the tidal volume. The many factors that are affecting also the respiratory capacity. From those factors, the size of the person, so different sized, those who are having a large body build, mostly also their chest also will be, the size of the chest will be more, and the capacity it might be more. Sex, in female, mostly the chest is, or the body build is less than the male. Age, according to the age, here we are discussing mostly an adult. In age, when small children, they are having a small chest, so the amount of air will be less. And all by getting older, then until they are reaching adult, the capacity will be increased. Also, physical condition and physical illness will affect that. We will come to the respiratory volume and capacity. As we said, the inspiratory reserve volume, it is the amount of extra air that we can take forcibly over after the tidal volume, after the 500 ml of air that we are taking it normally. So we can, if we want to take a deep breath. So this deep breath, when we try to take more air, in this case, we are taking around 3,100 ml of air extra than the 500 that usually we are taking in at rest while we are in inhalation and we are exhaling it through the expiration. So the inspiratory reserve volume, it is the amount of air that the lung can be capable that, if we are taking a deep breath. The expiratory reserve volume, which is the amount of air also that can be forcibly exhaled after tidal expiration. This amount, it is around 1,200 ml. So after normal exhalation, breathing out, if I try to expel more air from my lung by force, I can expel around 1,200 ml. So it is called the expiratory reserved volume. Expiratory reserved volume, which is around 1 liter and 200 ml. Then we have the last one. The last one, it is the residual volume. The residual volume, it is also around 1 liter and 200 ml. So it is around 1,200 ml. That amount of air, it will remain inside the lung, even after forced expiration. So, so the residual volume of air, it is after most strenuous expiration, about 1,200 ml of air will remain in the lung. It cannot be voluntarily expelled. This is called the residual volume. So it is the residual volume that will remain to keep the alveoli open and inflated. Otherwise, and to prevent the lung from getting collapsed. So residual volume allow gas exchange also to go continuously between the breath. So the lung will never be completely empty from air. So the residual amount, the amount that will remain even after the exaggerated, or what we call it, forced expiration. So after that, around 1,200 ml of air will remain inside the lung in order to keep the continuation of gas exchange between the blood and the alveoli. And also it will help the alveoli to be inflated, open, and prevent the adhesion of the alveoli and collapse of the alveoli. In this way, if the alveoli is collapsed, no gas exchange will be there. The vital capacity, this is what we call it, the vital capacity. The vital capacity, it is the total amount of the exchangeable air. The air that can be exchanged either by tidal volume or the forced inspiration or forced expiration. So, which is the total amount of air that it can be in and out by various means, which is around 4,800 ml. 4 liter, it is nearly around 5 liters. It is 4.8 liters, which it is called the vital capacity. The total lung capacity, it is 6 liters. So the lungs, both lungs can hold around 6 liters of gases, of inspired and expired gas. So the vital capacity, it is the sum of the tidal volume, the inspiratory reserve volume, and the expiratory reserve volume. It is called the vital capacity, which is around 4.8 liters. In male and in female, it is around 3.1 liter, or 3,100 ml of gas. Now, the dead space, it means that the part of the respiratory system that there is no, or the zone of respiratory system that it has no exchange of gases between the external air and the blood or the circulation. So air that remain in conducting zone and never reach the alveoli. So it doesn't have an contact with the alveoli and the capillaries of the alveoli in order to get exchange of air. Because of that, it caused this dead space, which is it will be in the bronchi and the trachea and the upper airway. So it is in the non-respiratory zone, which is about 150 ml from the tidal volume, from the 500 ml that we are inspiring and expiring in each time. So those are non-functioning. No exchange will be there. The functional volume, which air that actually reach the respiratory zone. The respiratory zone means that the part of the lungs which has the alveoli, so which reach the alveoli there. So it is around 350 ml in each inspiration and expiration. So 350 ml that will reach the alveoli and at every time, and there will be direct exchange of gases between those amount and the alveoli with the other volume that might be there. Respiratory capacity are measured with what we call it spirometer. So the spirometer, it is a machine that we will breathe directly in it. By that, it will measure those volumes. So the dead space volume and functional volume. So the tidal volume, as we said, in breathing, it is 500 ml, which is the inspired and expired air in each inspiration and expiration. Here, the air which is conducting in the airway, anatomical, which called the anatomical dead space air, which is 150 ml, which is there in the trachea, bronchi, and the large bronchioles, which is in the non-respiratory zone. The rest, which is 350 ml, it is in the alveolar air, which is the useful air, which is participating in gas exchange. So it is there within the added in each inspiration to the gases, which is to the air which is there inside the lung. And it is in direct contact with the alveoli, so gas exchange will happen there. So it is because of that it's called the useful air. There is what we call it non-respiratory air movement. So there are respiratory movement, which is inhalation and exhalation, and we mentioned how that happened. Again, this is the upper respiratory tract, nasal cavity, pharynx, larynx. This is the upper. The lower respiratory tract, including trachea and primary bronchioles and the lung. From the non-respiratory air movement, there are one of them, which is the coughing. Coughing, it is not because respiratory movement, it is the inhalation and exhalation. Those are the main those are the respiratory movement. But non-respiratory movement, including cough. Coughing, what happened in case of cough? There will be deep breathing is taken, so the gluteus is closed and the air is forced against the closed, while it is closed. Suddenly the gluteus is open and blast of air passed upward. So coughing is there to clear the lower respiratory passage. So it will clear the lower respiratory passage from mucus secretion or dust, or so because of that we start coughing if any irritation is there from the mucus. The second one, which is sneezing. Sneezing, it is similar to coughing, so same as coughing, except air moves upward, is directed into the nasal cavity by depression of the uvula at the throat. So it is also clearing the upper respiratory passage. It is also coughing and sneezing. It is for clearing of the upper respiratory passage from any excrete. This is the sneezing. So coughing, clearing the lower respiratory passage, the sneezing, clearing the upper respiratory passage. Laughing, it will lead to deep breath, is released in a series of short expiration. So deep breath, then series of short expiration will be there. It is for expressing of happiness. Crying also the same as laugh. It is physiology, but it is express sadness. There is also hiccup. Hiccuping, which is diaphragm contraction, sudden diaphragm contraction, spasmodically while glottis is closed. So it will give a sound of what we call it the hiccup. So it is not useful. The function of it is not clear. Yawing, it is a deep breath is taken. So some hypothesis about the yawing, it is not established function. Yawing, sometimes it is in order to get a deeper breath. So while you are feeling sleepy, you will start yawing. Speech also, during speech, the air will come out. So the air is forced through the larynx, which cause the vocal cord to vibrate. So the vocal cord will vibrate. Action of also the lips and the tongue and the soft palate, it will form the word. So the speech, air is coming from the lung, it will move to the vocal cord. The movement also of our lips, the movement of our tongue, all of those, it will lead to the vocal communication and the verbal communication. So, as we said, those are the situations other than breathe, which move air in and out of the lung and may modify the respiratory rhythm. We'll come to respiratory sound. About normal respiratory sound, we have two normal breathing sound. Those two normal breathing sound, one of them, it is on the wide airways, in the trachea and bronchi. So it is called bronchial sound. So bronchial sound, which is produced by air when it is coming or passing through the trachea and bronchi. It is called bronchial sound. We can hear that sound by using the stethoscope. Usually we cannot hear the breathing of others, even if we are sitting beside them, unless if they have problem. But normally we will not be able to hear their breathing. We can use the stethoscope in order to test and to check the breathing sound, the normal breathing sound, which is bronchial and vesicular. The vesicular breathing sound, it is a very soft sound of air when it fill the alveoli. So it is over the lung tissue. So the vesicular sound, it is over the lung tissue. The bronchial sound, it is over the main air passage, which is the trachea and bronchial. Diseased tissue will produce other abnormal sound, like because of presence of mucus or pus in the airway, or due to narrowing of the airway due to spasm. So this will cause a different abnormal breathing sound. But the normal breathing sound, those are the two normal breathing sound. The bronchial, which is over the main, the trachea and the bronchi, and vesicular, which is over the lung tissues, over the alveoli. Next, we will come to the external and internal respiration.